Hello guys, my name is Reggie. I'll be taking over for the patient desktop this time. Right above the patient desktop is the main desktop, and right below that is my part, the patient desktop. It's the one with the house and the person, and right to the right of it, you'll see the patient header. Where my cursor is over is my patient name, SB Nurse 16 BCMA. Right above that is the medical record number. Right below that, the account number. To differentiate, sometimes when you call lab, they'll ask for a medical record number in case you want to specify and ask what's going on with a certain specimen. To the right of that is the location, 750A. Below that is current location, which means this patient could be down in radiology where they're having an x-ray at the moment. To the right of that, you have the gender, female, age 42, birth date. Below that is the attending physician, and the type of inpatient. It could also be short stay or observation. Privacy status. At times you can see that this will say VIP. So if you're another nurse, a transporter, and whatnot, please go to the responsible nurse for that patient and ask if you can go in. As you look below the patient header, you'll see what these are called tabs, which my cursor is currently going over. After and during report, everyone should be on the S-bar handoff, where during report you're getting a wealth of information. Clinical data, you'll quickly see CBC BMP updates along with PT, PTT, INR. The ADL activity will show you the last bowel movement. Shift review, show you any central lines, current height and weight. Patient care info, patient's NPO, visually hearing impaired or is an O2, and the administration health history for any surgical or other medical or injury history. Below that, you'll see the conditional orders block, meaning for an order to be carried out, a certain condition must be met, such as, for example, a potassium less than 3.0, infuse 20 milliequivalents of potassium. The reminders block is good for nurse-to-nurse usage, as you could put anything that you feel is important in relation to the patient, such as always knock before entering the door. On the order list block, you'll quickly see current orders. They could be active or stopped. And again, you can't double-click into this to see in detail. Again, it's just a quick rundown, as you could scroll up and down. Below that is an instructions notifications block, and anything important that the doctor would like you to do, maybe ABG on room air or 2 liters, will be down here as well as an example. After the S-bar handoff tab, I personally like to go to the inbox tab, because during your report, the doctor can order something on the inbox which just pops out, and you'd like to know if you have any current orders. So just hit a quick refresh and just see if you have any new orders. Document tab won't be used much, but since we are here, the reversal of canceled event will be very used a lot. On the reversal of canceled event, you can see everything that's been canceled, and yes, that even includes your meds from the EMR. So if you need to uncancel a med that was accidentally canceled, this is where you would go to uncancel it and make it appear on your EMR. I'll quickly X out of that. Next, we have a specimen collection tab, divided into 2, non-blood specimen for urine, sputum, or poop, and you have a blood specimen for any blood collection tab. The MAR IVAR tab, divided into 4 blocks. Okay. The most one that will be used heavily is the BCMA IVAR. Over here, as I expand, you will see a list of medications that will be named and that you have to give, and they will be timed accordingly at the times they are due. As I quickly X out of that, you can go down to the IV administration block. As I expand this, you'll see that your current IV fluids will be here, as well as any of your PCAs or epidurals. I will X out of that. Anything that says ICU here, my ICU coworkers will quickly address, but for now, we will go to family health history, in which you can add any biological bloodline family history. Again, this will be mandatory for any oncoming admissions in the future. Next, you can see the Pulse tab to see if it's a full code. You can see the problem list, which us nurses really don't use, but it's just the problem list relating to the diagnosis that the doctors have identified. Transplant lists will heavily play a regard into the patients up on the 7th floor, and you can see transplant coordinator notes on this block. You can see lab trending on this block as well. Dialysis, you can see hemodialysis medication orders that can be or have been used here, and hemodialysis orders for that patient carried out by the dialysis nurse on this block. Care planning, we won't go into that right now. Again, those were the patient tabs, and again, any things that say ICU will be kindly informed by my coworkers. Again, my coworkers will kindly inform you on any of the ICU tabs done by Marilou and Alan. As I move to the left, you guys will see something that says patient shortcuts. Click the arrow, it disappears, and click the drop down arrow, you'll see a bunch of patient shortcuts. When you click on chart review, you can review anything you want about this patient. It's allergies, intake and output, latest vital signs, the AccuChecks. And I'll click on AccuCheck just to show an example. But apparently we do not have any AccuChecks done that's been recorded, so we won't see anything at the moment. But again, on chart review, you can review almost anything about this patient. As I exit the chart review, I'll X out. Go back to my patient shortcuts, and you'll see patient schedule, which is very useful to new and all nurses, as you can see what this patient will go through for today. Anything that's in blue has been done. Anything that's in black has to be done. Work list will be a main heavy staple of what the nurse will be going through. Work list will include the chronological order of things that need to be done on that nurse's shift. So for example, vitals at 8 p.m. Then you'll see another vitals which is at midnight. Again, this will be pertaining to a lot of people that are on the med-surg floors. Okay. Unscheduled documentation. This is where you'd like to chart anything that is going to happen out of the ordinary. I won't go too much into detail with that. Nursing order entry. This is where you would order things that are ordered by your doctor. I apologize. This is where you'd order things that pertain to nursing stuff. This is where you can order SCDs, an early breakfast tray, things of that nature. Telephone written order is where you would order things that the doctors order. As I click into that, you'll see it's divided into 3 items: written, telephone, and telephone written. Telephone written is the most commonly used bubble that we'll use. As you take a telephone order and write it down on a piece of paper, that will be usually the course that you obtain an order. Telephone, you can use that if you're comfortable holding the telephone near your ear and typing in an order. And written is more commonly used if there is an existing order and you would like to modify that doctor's current order. Next, intake and output. That is an item that my colleague Jeff has gone into well in detail. Allergy documentation. If you click on that, you can add an allergy that possibly a patient forgot. Again, it's also an allergy update. Specimen label reprint. You would click on this if you feel you need another label for a specimen you collected. Maybe, for example, the specimen label you printed out is not legible or it just got dirty and soiled. Vital signs trend. If you just want to see the current trending of your patient's vitals, normally you'll be able to see that in this empty box, but there is nothing that's been recorded at the moment. Vital signs during hemodialysis. Again, you can see the vitals during the patient's 2 to 3 hour hemodialysis procedure. You can also update contact info at any time. So if a family member comes over and says they would like to be added to this patient's contact info, you can go ahead and do that over here. Diagnostic reports, something that is used pretty heavily by all nurses. Over here, you can see allergies, BTE notes, H&Ps. You can also see results of ultrasounds and x-rays. So diagnostic reports has a lot of other purposes aside from diagnostic results. Current summary is an item that my coworker Jeff will kindly go over. Device connects is something that is used for ICU. So for this purpose and training, it won't be talked about on this side. Print active orders. Click on that. If there are any orders, more commonly the ones that are used for wound dressing that you would like to print out and just leave in the chart so that you don't have to keep going into the computerized system, you could always print out a computerized order so that it's easier for you to look at next time or even for the oncoming ship. And again, this is most commonly used for wound care orders. Second, print patient label. You would do that to print a patient label, and you would use those labels to either sticker an addressograph, sticker a specimen that's been collected, or you would use those patient labels to identify anything that might belong to a patient when you send it to the lab. And lastly, this bedside numbers is something I will not go into any detail, as this one in Device Connects again is something used in the ICU. As I X out of this, and I'll X out of this, and again, that concludes my short info summary of the patient desktop. I hope that was helpful. Thank you. Have a beautiful day.